Preventable medical errors are now the third leading cause of death in the United States, somewhere between 220,000 and 440,000 deaths per year in the United States.
And I was woken up at 2 a.m. by the doctor, my vascular surgeon, who woke me up and said, "We need to take you in for surgery. We don't know if we're going to be able to save your leg." What? I came in for an ovarian cyst removal. You can't take my leg. That's not an option.
The concern about medical error is the lack of realization by the public at large. It really amounts to the equivalent of a 9/11 catastrophic loss every week of the year.
And I'm walking down the hallway and I'm pulled into a janitor closet. She looked at me and she said, "You didn't hear this from me because I will lose my job. You better get yourself an attorney. Their charts are off. They can't explain who gave what, when, where, why, how, and how much."
How did we ever get here? How did we ever get to a point where medical error is the third leading cause of death in the United States? Where people are dying not from the disease or illness that brings them to care, but from the actual care that they receive.
So now I had records that had been changed. I had 2 autopsy reports from the LA County Coroner's Office. I had arrest records. I had names from other victims of the surgeon. I had all this information, and you would think that it was enough to at least go to investigation. But the doctor wasn't disciplined. And like I mentioned, each day that I woke up, I couldn't help but think, who else was going to be harmed that day?
There are events that they call never events that should never happen. You should never operate on the wrong part of the body. You should never do the right operation on the wrong person. You should never have a medication error. These are just events that never should happen, and unfortunately, they still do.